So the reason why we did this analysis was the interesting results provided by the RxPONDER that showed that in hormone-positive breast cancer patients who were N1 node positive and had a recurrence score of 25 or lesser, there was some benefit with distant relapse-free and recurrence-free survival with adjuvant chemotherapy. We used the National Cancer Database, which is like a large national database, to select this subgroup of patients who were less than 50 years, who had a recurrence score of less than 25, but we included N1 to N3. And the reason we did this is because we wanted to see if there was an overall survival benefit, because the National Cancer Database can give us the overall survival information. So we did a retrospective analysis of this database, extracted these patients and did a survival analysis, and found that in this cohort, adjuvant chemotherapy did have an overall survival benefit. That is, when you add adjuvant chemotherapy to endocrine therapy, there was like a significant overall survival benefit. And the interesting finding was that when we divided the subgroup into those with a recurrence score of 0 to 11 and 12 to 25, only the 12 to 25 group had significance. So what I would say is, obviously this is a retrospective analysis which comes with its confounding. So it would be interesting to look for the mature analysis, the overall survival information from the RxPONDER, and also to see how the future studies go. But what we could conclude is we can say with a little bit more confidence that, you know, if we get a patient who are in this category and have a recurrence score of say like 15 or 20, we could recommend adjuvant chemotherapy to them. But, you know, if they have a very low recurrence score, I mean, although the RxPONDER did show some benefit in all patients from 0 to 25 who are premenopausal and less than 50, you know, it would have to be an individual discussion with the patient, and obviously further studies and the mature analysis from RxPONDER would give us some information.